Once we have a positive InflammaDry MMP-9 test, I initiate different treatments. Of course, it's customized to every patient's needs. And then upon return, I often repeat the InflammaDry MMP-9 test again to demonstrate efficacy of my treatment. If it's negative, I know that A, the patient is being compliant, and B, the chosen treatment paradigm that I have selected for my patient is working. So that means both the patient and I are happy.
Testing for MMP-9 levels is something that has become an important part of my practice. We know that inflammation is central to ocular surface disease, and really until recently we haven't had great tools to allow us to test the tear film and to understand what's happening on a molecular level. The MMP-9 test is an easy clinical test that shows us if there's elevated MMP-9 levels, which is a nonspecific marker of inflammation. One of the ways that I found the MMP-9 test most valuable is that it allows me to know if I need to treat critical levels of inflammation. We know that inflammation can lead to chronic progressive disease and damage to the structures underlying. However, sometimes it's not visible to us, and so this point of care test allows us to know if there's inflammation. I'm more apt to put a patient on an anti-inflammatory or a chronic immunomodulator if I know that they have critical levels of inflammation, because it's important to achieve good control of that inflammation to have the patient have the best outcomes in management of their disease.
So the clinical results of MMP-9 testing helps me dramatically in my day-to-day practice. Again, both in my ocular surface patients, but also in my preoperative cataract and refractive surgery patients. A positive MMP-9 tells me that the eye is inflamed, that the inflammation is leading to a lot of the symptoms that the patients are complaining of. Could very well be visually significant in the case of a preoperative refractive surgery patient. So I feel very compelled to treat those patients when I see a positive MMP-9 test, and usually that treatment is going to involve an anti-inflammatory medication like a steroid.